Last year, 1.4 million Americans traveled overseas for medical care. Medical tourism is exploding and has been for a while, but now it's going both ways, with companies now sending American doctors to foreign hospitals to do surgeries on American patients because there is so much demand. Caitlin O'Shaughnessy started Doc Tours after running a successful luxury travel company.
I immediately started Doc Tours just because I saw there was such a huge demand and need for it, and there really were no resources available to make medical travel easy and accessible.
According to the American Journal of Medicine, medical and dental tourism is a $439 billion global market. Oh. And Caitlin says her company saves patients anywhere from 30 to 80% on procedures. And all kinds of procedures, everything from knee replacements to hip replacements to cosmetic surgery to open heart surgery. But cheap care doesn't matter if it's not good, right? Caitlin says her company vets on several levels.
Work with hospitals that are JCI accredited, which means Joint Commission International, which means that they're up to the same standards and protocols that you'd find here in the U.S. We also work with over 70% of our doctors are actually Western trained, meaning they've came to the U.S. for their medical school, residency, or fellowship or training. We also work with insurance companies to check for any malpractice that they had in their backgrounds to make sure that we're only working with the top qualified candidates for you.
A friend of mine is a surgeon. They go overseas and they help kids with cleft lip palates, right, all over the world. But they do a lot of vetting. I mean, they go in and they have to look at the hospital, the staff. I mean, they do a lot of research before they go in.
Yeah, and those are such wonderful charitable things that doctors do. This company deals with like luxury tourism, like you want to roll a vacation in with your hip replacement. Okay, so not all medical tourism companies, though, are created equal. You've heard the horror stories, and Judy Gaman from Executive Health says most of the overseas care is actually not up to American standards.
And not all medical tourism is actually vetted the way some of these people do. I mean, there are companies out there, and I think you spoke with one of them, that vets the surgeons, the hospitals. They vet through the process. But the majority of medical tourism isn't going through that vetting process, and that's scary.
And I actually asked her about the trend of American doctors going overseas to do surgeries on Americans and why, that is. And apparently it's because they can do the procedures for less, make more, and they cut the insurance company out of the middle, kind of. So I asked her, though, is this a safe thing, American doctors going overseas to do surgery on American patients?
Yeah, the other worry is if you have surgery in a foreign country, even though you have a medical doctor from the United States performing that, it gets really tricky when you get into, like, say the surgery doesn't go well. And then what recourse do you have? Because their medical malpractice would not necessarily cover them having doing surgery in a foreign country, in a foreign hospital.
I would see that. There are layers to this.
Right. So buyer or patient, beware. Just because it's an American doctor doing the foreign surgery doesn't mean you're in the clear if something doesn't go right.